Today we are joined by one of global health trailblazers, Dr. Prativa Baral.
And then 6 months into my PhD, the pandemic happened. And so that kind of shifted, I think, everything. Cold emailed professors and said, what can I do? How can I help?
When we hear global health strategy and all that, we tend to focus only on the US. But why do you think this events how nations should better prepare?
You can have a virus in one part of the world, but with travel, with everything that we have these days, it's not very long before that virus can show up in your doorsteps, where people just care about things as if it affects them personally. And if it doesn't, then they're like, people can handle it, that other countries can handle it. But that's not how global health works. That's not how viruses work. That's not how global emergencies work. And I feel like we're constantly having to learn this lesson over and over again.
So what strategies work really well for you in your cold email strategy? Good morning, everyone. Welcome back to another episode of Global Health Uncensored. I'm Dr. Banda Khalifa. Today we are joined by one of global health trailblazers, Dr. Prativa Baral. She's the Deputy Director of the Pandemic and Emergency Readiness Lab, PERL, at McGill University. She's also Assistant Professor at McGill and a Faculty Associate at Johns Hopkins, and she co-founded Let Science Connect. Dr. Baral is a global science systems builder, a researcher and educator whose work sits at the intersection of AI, misinformation, crisis response, pandemic readiness, and global health security. She has worked across institutions, including with World Bank, WHO, Gates Foundation, Hopkins, helping translate ideas into systems that can operate under pressure. At a time when emerging infections like Ebola and hantavirus are testing global preparedness, this conversation asks a critical question. Can AI, better communications, and stronger readiness systems help us respond faster, or will they expose how fragile our systems still are? Dr. Baral, welcome to the Global Health Uncensored.
Thank you so much. Such a pleasure to be here. Thank you for having me.
Sure. I must say I've been a fan of your work. I've been following you on LinkedIn, and I recently got to know that you have my advisor's name. He's also Baral. So most times when I'm sending an email to my advisor, I type Baral, and then you pop up in my email list. And I said, no, this is not a Baral I'm looking for.
You know,
Anyway,
it's so funny. We actually met back in the pandemic. We met on Twitter and messaged each other on Twitter. And I asked him, wait, are we related? Are you Nepalese too? And he said, oh, no, I've just got it. But yes, huge. So
I think the other overlapping aspect is that he's also from Canada. So
exactly.
Anyway, so I mean, for those who don't quite know you and haven't heard your journey, maybe you can take a few minutes to kind of tell us about your academic journey. A lot of my listeners are prospective applicants, so they get excited listening to academic stories and, you know, how you ended up this space that you've carved for yourself.
Absolutely. I'll try to stick to the academic stuff, given your audience. So when I was an undergrad, I think like many folks who are in this space, I was a pre-med major. I thought that I wanted to go into med school, wanted to be a physician. But then when I was 16 years old, I had the opportunity to work with refugee families that were coming in from Bhutan, and they spoke Nepalese. And my initial language or mother tongue is Nepali. And so I was kind of put into this world of translating between the new families that were migrating or are coming into Canada and various different stakeholders here in Canada, whether it's clinics or lawyers or just going to get their health cards. So I kind of was put into this brand new world that until then I had unfortunately been sheltered in, where for the first time in my life I was able to see what healthcare access looked like, how challenging it can be to access healthcare, even in a place like Canada where it's supposed to be universal and available, and really get to see the inequitable distribution of resources and health outcomes at the global scale. And so when I was an undergrad, I did my bachelor's here at McGill in anatomy and cell biology. I decided to do my minor in social studies of medicine. And so that way I was able to kind of be exposed to a lot of the things that I just talked about, whether it's the anthropology or sociology of medicine or even the history of medicine, to kind of try to understand health and global health from a very holistic lens rather than just a biomedical lens, which, as you can imagine, can be quite problematic. So that kind of shifted my entire career trajectory, where instead of going into med school, I shifted focus and decided to do my master's in epidemiology at Columbia University, to the detriment of my mother. She really wanted me to be a physician. So I went to do my master's in epi at Columbia, loved it, learned a lot of methods, worked for 2 years-ish in a global health think tank back in Toronto called Global Strategy Lab, that again made me understand global health from not just like a policy level, but also from an epidemiological level, from a implementation level. And then I decided that it wasn't enough for me to be done schooling. I really wanted to be in a space where I could really hone in my methods, but also be exposed to all sorts of different projects and aspects of global health. And so that's why I picked Hopkins. And so I did my PhD at Hopkins. And then 6 months into my PhD, the pandemic happened. And so that kind of shifted, I think, everything, because I'm an epidemiologist by training. And so I kind of went and I said, well, this is kind of what we've been training for our whole career. And so I jumped, and even though I was doing my PhD, I basically cold emailed folks, cold emailed professors and said, what can I do? How can I help? We are stuck indoors, and I have some of the skills I think that could be useful while the world was navigating a global pandemic. And so how can I help? And so a lot of the really interesting work that I was able to do in the last several years was in large part because I reached out to folks during the pandemic and said, let me help, because perhaps there's something that I can do here to contribute. So that's kind of a short blurb of my journey. But I think to some of your audience members who are listening, who are kind of trying to decide what to do and where to go from an academic perspective, I think sending out those cold emails and just being very enthusiastic and open to contributing and feeling very strongly about it will open up a lot of doors.
Yeah. And I know, like, you after your PhD, you went back Canada to help build the Pandemic and Emergency Readiness Lab, otherwise called PERL. This was last year. I saw the announcement on LinkedIn and elsewhere when Professor Madhu shared it, and I found it very fascinating. So, I mean, in conceptualizing this, what gap were you trying to fill by establishing this unique center within McGill?
Yeah, so there's a number of things that I was thinking about when I was developing this lab with Dr. Joanne Liu. So she and I built this lab. She is the previous international president of Doctors Without Borders, of Médecins Sans Frontières. And so when I came in, I realized there were a number of different things. I mean, from a geopolitical angle, I think there's a lot less focus on pandemics and just emergencies in general, which is really disheartening, because we do need will and we need resources to be able to do the work that we do, especially with regards to prevention of emergencies, where obviously, as you know, when you invest in something and it doesn't happen, it's a lot harder to make the case for some decision makers. So one of the gaps that we were trying to fill was really to say, okay, there's a lot of panic neglect cycle with regards to emergency preparedness and emergency response, and what can PERL do to kind of make sure that this is always being talked about, that there's work that's always being done in this space, so that when crises happen, we're not steering the ship and building it, although of course that's part of the pathway. So that was one piece. The other piece was really recognizing that when we look at emergencies, oftentimes we tend to focus on the acute aspect of it, right? So the emergency response, something bad happens, we put in a lot of resources towards one thing, and then we forget about it, in large part because we're traumatized by what just happened. And I think in a lot of ways that's what happened with COVID. But in a lot of other parts, I think it's because of the way that our political systems work, the 4-year cycles and whatnot. It's really hard to get folks to be invested in the long term from a decision maker perspective as well. And we kind of wanted to challenge that. And then the third piece I would say for PERL that makes it quite unique is, instead of just focusing on research, we have 3 different pillars. So there's the research aspect, which is of course essential to our work, but there's also a convening aspect. And that is because And a lot of times in global health and in emergencies, there's a lot of really interesting work being done or being invested in, but it's oftentimes in silos and it's oftentimes with people doing it not necessarily knowing who's doing what. And we wanted to build PERL to be a place where it could provide that convening space as well, so that people can understand the larger landscape of like, oh, this group is doing this. How can I build and leverage what's already being done instead of duplicating resources and whatnot? So the coordination aspect is something that we're actively aware of and trying to build towards. And then the third pillar, so I mentioned research, I mentioned convening, and then the third pillar is also it's crisis leadership. So you can have all of the science in the world, but if you don't have the right type of leadership, then there's only so much that you can do. And so that's also something that PERL is focusing in on, is how do we develop a pipeline of really strong crisis leaders? How do we understand leadership? How do we make it a forefront of all of the work that we do? Particularly in emergencies, you need great leaders. And so I think that's what we were thinking of. What I was thinking of when we were building PERL is, research, convening, and leadership that together builds that larger pipeline that I think is necessary when you're trying to think of emergency preparedness and response.
Okay. So I want us to bring this into the current moment that we are in. When you look at the Ebola Bujumbura outbreak and the hantavirus cruise ship cluster, what do they reveal about the state of global health security right now? And also from the perspective of, being in Canada. I know most of the time when we hear global health strategy and all that, we tend to focus only in the on the US. But what do you think this events reveal about the state of global health security and how nations should better prepare?
Absolutely. I mean, I think those were examples of stress tests. I'll talk about hantavirus first. It's like in EPI, as you know, what's one of the first cases that we talk about when we think about outbreaks? It's cruise ships, right? And more often than not, we talk about it from a norovirus perspective. And so to see this emerge in a cruise ship was not a shock to many of us. I'm a big no cruise ship person because I just cannot imagine being stuck in one little space where there's so many viruses or just so many as exposures that are possible. But that being said, I think it was a really good example of a stress test of how can we as a world coordinate and be prepared for various types of outbreaks. I did a lot of media interviews when the hantavirus outbreaks appeared. And it was really interesting because for a lot of people, especially in regions that were not affected by that, the go-to was always, oh my God, are we in another pandemic? Are we going to have a lockdown? Are we going to have this and that? And I think because we never really took the time, I think, of processing the incredible global trauma that we all went through with COVID, as soon as we see a headline about an outbreak, even though we all knew, at least those of us who are working in this space, knew that, this cruise ship is unlikely given the way that the hantavirus is transmitted, all of the science behind the virus, we all knew that this was not going to be a global pandemic. And yet from a general population perspective, that was a really genuine concern, which speaks to a lot of work that we need to do on our end to get folks to understand this. So I think it was a good stress test. But I think when I think about global health broadly and global health security, it's kind of the same frustrating thing of a number of countries who kind of have all the resources and have all the say and have all the power that kind of decide how the rest of the world should react. In the United States, for example, and also in countries in the West, a lot of the approaches to global health security and global health has been very bilateral recently, or more focused on security rather than more of a solidarity approach. And that is to a large detriment to the field. As we saw with COVID, you can have a virus in one part of the world, but with travel, with everything that we have these days, it's not very long before that virus can show up in your doorsteps. But I feel like right now we're in this really unfortunate phase where people just care about things, or countries, I should say, not people, nations seem to only care about things if it affects them personally. And if it doesn't, then they're like, well, people can handle it, that other countries can handle it. But that's not how global health works. That's not how viruses work. That's not how global emergencies work. And I feel like we're constantly having to learn this lesson over and over again. And so if we look at Ebola right now, it's absolutely devastating what's been happening. There are limited resources that are there in order to support the contact tracing, the care that's being needed. But I think what's really interesting from, again, where we stand on the Western side of things is the amount of ridiculous measures that are being put into place. Like, for example, travel measures. I mean, we know those don't work. We also know from how Ebola is transmitted that this is not how it's most likely to be transmitted. And yet, every time there's an emergency like this that happens in another part of the world, the United States and Canada and countries just say, okay, no, we're going to close the borders, and folks who are coming in who are from those nationals, we're not going to process their visas, we're not going to process this. And so when we think about it, I think this field, I'm not being cynical, but I think this field has a lot of reflection to do with regards to how we even define global health, how we operationalize global health, because we write op-eds and we write essays about solidarity and we're all in this together. But then when it comes time to make decisions and to say, okay, what do we actually need to do? We always pick the selfish route, even if you were to look at it from a purely economic perspective, even if you were to look at it from a selfish perspective, by protecting the world, you are protecting yourself as well. So from the moral perspective, it's very clear. But even from a selfish perspective, it's very short-sighted, I think, what some of the nations are choosing to do. So I don't know. I think there's a lot more that we need to be doing in this space. I mean, we can also talk about the pandemic agreement and the negotiations around that as well. But I think sometimes I think that this field has to kind of rebuild from scratch. If we think about how historically this field was built, we just need to rebuild from scratch, like rethink about our moral compass, our values, like what do we actually mean by global health? What do I mean by global health versus what you mean by global health? Are we aligned when we talk about global health and global health security? I feel like people are kind of going along with their own definitions and kind of taking a more selfish approach to it. And when I say people, sorry, I should really say nations, not people.
Yeah. I had an interesting discussion with Professor Nuzo, like the director of the Pandemic Center, I think a couple of days ago, and it was the same sentiments that we all shared. People or countries rush to place, these draconian bans or measures in other countries, which eventually doesn't work.
No.
As you said, we need to reflect and rebrand what global health is, set priorities right. But we can't talk or we can end this podcast without discussing AI. And how AI can be used in health. I mean, you are in pandemic preparedness and emergency readiness. Where do you think AI can genuinely make a difference? And while, talking about that, what would you say are some of the most promising use cases of AI? Is it early systems, outbreak analytics, supply forecasting? Like, which specific areas have you thought about that AI may be very useful?
Absolutely. And I think it's kind of a whiplash going from global health solidarity to AI, but there's common threads there as well. I think when I think about AI, it's really important to think about, like what exactly is it? I think people think like there's some people that think this is going to solve every single problem. And then there are others that are very, very cynical about it. And I think for me, I'm somewhere in the middle where I see a lot of potential for how AI can be used. But I also think about equity quite a bit in terms of, okay, if we build these amazing products with AI and these amazing processes, who has access to it? Who gets to benefit from having access to these sorts of innovations, right? So whether it's AI or it's vaccines or it's, drugs, life-saving drugs, I think the core question of equity remains. So that is something that should be set from the beginning. Now, with regards to AI, important to know that it's, when we think about generative AI, really it's about creating new content based on learned patterns from existing data, right? And I think with regards to emergencies and pandemics in particular, there's so much potential. So one example that I can think of, so in June of 2022, there was a South Korea-based developer that received licensors for its COVID-19 vaccine. It was made in partnership with a couple of other institutions with funding from CEPI and University of Washington, I think. And what was really cool about this vaccine is that it was the first computationally designed medical product to be approved, and it was basically developed using AI. So I think there's so much really interesting work being done in this space, like Google DeepMind's AlphaFold, for example, is another AI system where it can kind of predict a protein's 3D structure based on its sequence of amino acids, and that kind of shifts the way that we think about structural biology. So from a health and biology and science perspective, whether it's drug discovery or development of disease detection and prediction, there's just so much work that's being done in this space. But a couple of things that I think about with pandemics specifically, I think detection, we often talk about monitoring as one of the hallmarks of being better prepared. And I think outbreak detection, especially real-time outbreak detection, which we struggle with quite a bit, there's a lot of potential here with AI. There's already a couple of prototypes and examples, whether it's an AI tool, Blue Dot, for example, that kind of flagged some clusters that were unusual of pneumonia in Wuhan days before the WHO public alert. There's, I also think that, sometimes in epi or sometimes in our field, we tend to focus on specific data systems or databases that are quite siloed. And with AI, there's a potential to integrate multiple types of data sources, whether it's wastewater surveillance, climate data, but also social media data, and you put it together alongside traditional epi data, and you can catch signals that I think traditional public health systems sometimes miss just because we don't have that integration there. So from a outbreak detection, from like data sources, putting together data sources, there's a lot of potential there. I also think about things like wearable AI tech, right? Can also enable real-time health monitoring in ways that we weren't able to do before. So perhaps, to be able to kind of be able to detect pre-symptomatic infection at scale. So again, lots of really, really interesting approaches here. But I think I still come down to you can have all of these incredible advances, but then who gets access to it? Who gets to use it? And also, I talked about integrating different data sources, but that's assuming that the data exists. And so again, it goes back to the biases in training data or biases in data with regards to whose data are we using to make these innovation, and does that mean the products that come out of it, how biased are they, because who do they represent? So I think there's larger questions that need to be considered when we talk about AI in health, but oh my gosh, there's so much potential here. Absolutely.
Yeah, I agree with much of what you've said. And the caution here is to make sure that whatever product we get from user data, we also put back to the communities that have to benefit from the data that we used. And I think another dimension is also the ethical aspect of AI and how governments see their data sovereignty. A lot has happened in the past couple of days or in the past couple of months, especially with the US and other countries trying to sign a bilateral agreement. But our last segment is misinformation. I don't know if you're still on Twitter or X, but I know a lot of scientists have run away from X. Elon has been able to chase away most of my professors. But in emergencies, even as we speak, in Ebola and the Andes hantavirus, there's so much misinformation. And most of the time, it moves faster than how institutions can respond. And recently, I saw WHO chief him respond to some of the misinformation. I'm like, yeah, game on. So should public health systems really prepare for the information environment that we are currently in? And I know you've done a lot of crisis communication. What does good crisis communication look like when especially uncertainty is still high and fear is spreading?
Yeah, absolutely. I think misinformation is such an important and such a tricky topic, and it'll affect everybody. It certainly affects folks working in the emergency, pandemic, health emergency space, but it affects everybody, all of us, right? There was a really interesting talk that I listened to yesterday where the speaker was talking about how in the past we would have human to human connections, and now we have human to algorithm to human connections, where everything that we get exposed to, whether it's news, whether it's information, is biased or filtered, I should say, through various algorithms, right? Sometimes I poll my students and I ask them, okay, how many of you read the news, or how do you access your news? And Gen Zs in particular, or undergrads in particular, the way that they are exposed to different types of news is through social media. So I think that's the biggest part of misinformation that we need to think about is really what are the systems in place that are making our information systems, the ecosystem, the way it is. And I think sometimes we tend to overtly focus on this problem as if it's a knowledge deficit problem. And I don't think that's necessarily right, right? So we know that misinformation is not just about giving people the right information. It's a lot more complicated than that. I teach an entire course on misinformation, disinformation at Hopkins. And so a lot of the ways that we look at this problem is about, okay, what does it mean from a cognitive biases perspective? What is the psychological approach to understanding this problem? What are these systems in place that make it so that people have access to certain types of information and not? What are the identity aspects of this that make it a lot harder to tackle this problem once misinformation has trickled out? Because it's never been about a knowledge deficit problem. Like I said, it's really about shifting. It's an identity issue where people feel like there's a sense of community, and so they become part of that community because they're looking for an answer, and then that community happens to be propagating a type of misinformation. So it's very, very complicated and multi-layered, and it's not a knowledge deficit problem. With regards to your crisis comms, it's very closely linked to the way that I approach misinformation as well. I think a lot of the times, particularly when you're scientists, you like to think, or when we communicate, at least, one, we're not trained in communication. So I am a huge, huge, huge proponent of making sure that every single person that goes through an epi degree, a public health degree, or any type of health degree needs some sort of communications training. And it doesn't mean that you have to go out there and be an influencer on social media, but it does mean that you need to be able to communicate your work in a way that the general audience, funding agencies, politicians, policymakers can understand why and how you're working in your space. So that's one. I think there's a comms gap or comms training gap that we need to talk about. The other thing that I think we need to talk about is that we're not really good at communicating uncertainty. And part of really good crisis communication is being able to say, you know what, we don't know at this moment in time. We are monitoring the situation. As more data comes in, we will be able to be in a place where we can provide a little bit more certainty or a bit more clarity into the situation. And I think just saying that you don't know, but that you're working on figuring out an answer would build a lot of trust and would allow people to actually trust the communicators, rather than saying something very definitively and then coming back and say, you know what, never mind, we were wrong. And so part of crisis comms is acknowledging uncertainty explicitly from the beginning, and then kind of explain the process of what you're doing to learn and to kind of understand what's happening. And then I think fundamentally crisis comms is about trust. And we talk a lot about, how do we build trust in public health and how do we build trust in medical establishments? And to that, I always say, I think it's really important to not just think about it from that perspective, but from the other side, right? How can we make it so that we are trustworthy? Right? Folks and communities will trust medical establishments and public health establishments if their needs are being met, if they are feeling heard. And if we're constantly in our offices just talking about things from a top-down approach and not really being with our communities and really understanding what their needs are, then we're never going to get that trust piece. So I think there's a bigger conversation here about how do we become trustworthy, and that will very clearly or very cleanly linked to better crisis comms. It's a lot easier to communicate if you have trust and if you are trustworthy within a population. And so I think beyond the training and making sure that we know how to communicate our work well and communicating uncertainty, fundamentally, it's about how do we become better humans and better communities where we are listening to the communities that we serve and that we work with so that they can trust us. And so I would flip the narrative a little bit about how we build crisis comms is by really focusing on being trustworthy as scientists, as public health institutions, as researchers. There's a lot of work that needs to be done here so that we're not constantly just going to communities when we need their data and not really hearing them and working with them.
All right. I think, as I said, a large part of my community is prospective applicants and early career professionals. So maybe let's talk a little bit about graduate school.
Yeah.
It's been a while since you exited, but you're still new relative to some
Absolutely.
of my guests. Yeah. So, I mean, for those who are really looking into stepping into the public health space, for example, those applying to PhD especially, what would you say is some of the most important considerations in the application? What should they really be looking at when applying for a PhD
Yeah, I feel like I did this. I mean, I think none of us have a linear path, but I think in particular when I was applying for my PhD, and you're right, it wasn't too long ago. I just became faculty a year ago, so I still relatively remember what it was like. I just remember being very enthusiastic, just thinking of how can I stand out? There's a lot of applications that come into PhD programs. And so, what can you do so that your unique self, and every single one of you listening in is unique? How can you show that uniqueness to the application committee? I think that was the North Star that I used is what can I do to stand out? And so all of the applications that I wrote was really focused in on that, on highlighting aspects of my story, of experiences that I've had that I thought were fairly unique that would make me stand out. Now that I'm on the other side, now that I'm a faculty and I'm reviewing applications and whatnot, I think it's important for students or folks who are applying to grad school to remember that we are humans and we review a lot of applications. And so if we read something that really stands out, that's like very enthusiastic, that's very like that makes us pause being like, whoa, this is really cool, this is really neat, then I'm more likely to be like, oh, okay, let me like reread this again,
program?
versus if you are just using AI, for example, to just generate a very non-unique typical essay, then I will read it still, of course, but then I'm more likely to skim it rather than if I see something that really is unique. So what is the unique aspect of you that you can really highlight, is I would say something to focus on.
Okay. And the element of cold emails, I know like the dynamics changes from time to time, but what would you say is the best strategy to adopt for cold emailing? I remember when I was applying for my PhD, actually, like my first choice was McGill University for their pharmacoepi program. I applied there, and one of the professors sent me an email telling me that, oh, he just discussed with another professor, and that the other professor says I've sent him another email. So I
Uh,
should focus on getting not sending random emails to professors in every department, but focus on specifics. So strategies worked really well for you in your cold email strategy.
Absolutely. I'm a huge fan of cold emails. So I've done it for my career. A small example was during the pandemic, I reached out by cold email to the Canadian COVID task force and I said, I want to help. How can I help? I sent out an email and they responded. So I think if you're really authentic again, I'll go back to authentic and enthusiastic, you're more likely to be read. Again, now that I'm on the other side, I receive a lot of cold emails. Some of them are very clearly AI generated, some of them are very clearly not for me. It'll say, Dear Professor, and then it'll just say broadly, I am interested in health systems. And I'm like, yes, me too. I'm also interested in, like, do you know anything, can I know anything about you, and do you know anything about me so that you think this could be a good fit? And I think you have to look at it from a bi-directional perspective, right? Like, I'm getting to know prospective students and the prospective students are getting to know me. And so if I see an email that is very clearly talking about some of my work or some specific new research paper that came out that they think I would be interested in, then I'm like, ooh, interesting, like this is authentic, this is
Yeah.
someone who's actually taken the time to write an email, rather than I receive a lot of emails now from students who I'm sure are wonderful human beings and want to work and want to do a PhD or grad degree, but it's very generic and not specific. And so those ones I'm less likely to take a large interest in, just because we get a lot of emails. I also want to acknowledge that it takes a lot of work on the student side to tailor the emails, to send out the email to different professors. And so, like, for those of you who are doing that, kudos to you. Keep doing what you're doing. But I agree with what you said earlier. I think it's a lot. it's important to have a far-reaching net, but still be specific. Like it cannot be one AI generated letter that's sent out to 200 professors. You have to be a little bit more selective with regards to who are the people that you actually want to work with. What are you actually interested in? Are they able to provide mentorship or potential opportunities that you will actually be interested and enjoy? So big fan of cold emails. I will say, in addition to cold emails, another strategy that it's worked really well for me is if I speak to a professor and the professor told me, oh, based on your interests, you should speak to XYZ, that in the next email that I write, I'll say, oh, Dr. Baral said that I should speak to blah, 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 that I should speak to you because
Yeah.
you're of your interest in da, da, da. And I think it's still a cold email, but because there's that colleague's name in there,
Yeah.
higher likelihood of getting a response rate
Yeah,
than just like
that's
a
true.
pure cold email. Yeah.
Yeah, that's true. So the one last aspect that I want us to talk about is considerations for recommendation letters. And maybe we can add that with what is unique about McGill University that you think like students will thrive there. I know like I recently had the associate dean a couple of months ago, and he was like, McGill is the Harvard of Canada. So, so let's talk a bit about maybe just a brief summary about what should students consider when they are selecting their recommenders, and also what is there for prospective applicants or prospective graduate students at McGill that they should explore.
Absolutely. I will say for recommendation letters, I'll say the same thing that I said about your letter is can the person that you're asking to be your referee speak about you in a meaningful, authentic, and unique way? Can they highlight unique aspects of you? I receive requests to write recommendation letters from people that I met maybe just once. And I have to tell them, unfortunately, I don't know if I can write a solid recommendation. I can't write a solid recommendation letter for you because we've only met once. We've never worked together. I can't talk about you in all of your beautiful, holistic self. All I can say is that, let's say you took my class and I saw you once and you got an A. So that doesn't really provide value. The point of recommendation letters is to really get the committee to see how other colleagues see you. And so if you can find people that you've worked really closely with or professors that you've taken their class and they know you really well because you are actively participating in the class and that you know them really well, then they would be a great fit because they can talk about you not just from this person took my class and got an A or got a B, but this person took my class and she is wonderful because of this, this, this. She brought in lots of valuable insights like this. She would be a great fit for the program because of her methodological rigor, and I can see a lot of potential in her as a graduate student, right? So you want someone to speak about you in like not in a neutral sense, like she took my class and got an A, but like in a, oh my gosh, this person will be absolutely beneficial to your PhD program, where she will appreciate being in that program, but the program will also appreciate having her because she has a lot of value and a lot of thoughts and intelligence and creativity and entrepreneurship to provide. So I think for referral letters, I would be careful and very selective in picking people that can really sing about you rather than picking someone that'll just say, yeah, sure, this person came to my class and got an A. So that's what I would say. With regards to McGill, I'm a faculty for just a year, so 1 year. So I don't know how much I can share or even say about the application process here at McGill. I think it depends on whether you're applying for your PhD versus if you're applying for your master's. There's obviously different types of criterias and whatnot. I know that McGill and the School of Population and Global Health where I'm at is really well known for being very methodologically rigorous. So if you're interested in specific methods, the EPI program here is absolutely fantastic. The Department of Global and Public Health, where I am, is a growing department. And, Dr. Madhu Pai is our chair. And so a lot of our work that we do is also methodologically rigorous, but also has, I would say, an element of like advocacy in it, which I really, really love. So it depends on what you're interested in, but I have been very happy as a faculty here and see the students here. And I think from a science and epi and methods perspective, the school is really, really, really strong. We also have different centers at McGill. So I'm the deputy director of the Pandemic and Emergency Readiness Lab. So for folks interested in emergencies, who are interested in that type of work and policy work and applied research rather than just typical research. So I think applied research in particular, PERL is fantastic. There's a climate center here. There's all sorts of new things that are happening at the school that will be interesting to students, I think. But yeah, I would really explore. This is what I would tell students all the time: is if you're interested in a school, speak to professors, of course, but don't forget to speak with other students, because the other students can really give you a perspective of what it's like to take classes, to do research, to do advocacy work in an environment in a way that as professors we don't really get to see as much because we're on the other side. So don't forget to speak to both faculty but also to other students and other peers who can really tell you what it's like to be a student in that school.
Awesome. Thank you so much for sharing those practical thoughts. Listeners, we have our last segment, which is quick ticks, short questions, short answers. It may not be perfect, but we go with it.
Let's do it.
The first question is one habit that helped you build something ambitious from scratch.
Just jump, just do it. Even if it's not 100%, even if it's 50%, you will learn a lot by just building rather than thinking. So get out of your head and just do the damn thing. Just do it. Just do it. Yeah.
The hardest part of moving from idea to implementation.
I think it's very much similar to what I just said. It's again, letting go of that initial inertia where you're thinking about the idea, oh, how will it work? How will it not work? Until you start and actually start putting together the pieces, even if it's the beginning, even if it's a prototype, even if it's the 1/10% of the broader idea that you have. That's the hardest part, because once you've jumped, once there's a momentum going, it's a lot easier to keep going. So I would say it's the initial push from idea to implementation, because once you start, it's a lot easier to continue.
Yeah, okay. One skill outside of global health that has helped you most in global health.
I would say communications, like communication under pressure, in particular, communicating to different stakeholders, knowing how to express your value, the value of your work, the value of your research to different people and different funders, different stakeholders, and really being able to bring that bridge so that they can understand what you're doing and you can also share with them how the work that you're doing is contributing to their work. So really being able to speak in a way where you're not just speaking to a scientific or an academic audience, but can get other people to understand the value of your work.
Awesome. When the work gets heavy, what helps you reset?
Ooh, I mean, I think working in this space, and it can be a lot, can be hard. What helps me reset? A couple of things. One, I read a lot of fiction books. I didn't read for a long time, especially when I was a PhD student. You don't have the time. And then now I think getting back to reading, fiction in particular has been really lovely. The other piece is just getting outside, going to nature, going for hikes, being with your friends, your family, eating good food, recognizing that the work that we're doing, there's a lot of work that needs to be done, but you're not doing it by yourself and not everything has to be done today. And so kind of shifting the framing that we're in this together. And so to find your community of other people who also believe as strongly as you do in the work that you're doing feels like there's a little less pressure on yourself because you're certainly not alone.
Coffee, tea, or something stronger after a long day or before a long day?
So what's so interesting? I don't drink caffeine at all, and I never did during my PhD too, which I think back and I'm like, how did I do it without coffee?
Yeah.
Nothing. I like my water. It's a boring, but sparkling water. I'm a big fan of sparkling water. And lately, I've been more and more really loving hojicha. It's a type of green tea that's really delicious. So I will say hojicha. Yeah.
Okay. Well, recently I had a conversation with the director of emergencies at WHO Afro, and she was like, "No caffeine in diplomacy."
Oh, I didn't know that, but I like that. I like that. Okay.
So there's no caffeine in diplomacy. I was like, "Oh, okay, I get it." Anyway,
I
so
get it.
thank you so much for making the time to join us. I've really enjoyed this conversation, and as I said, I'll always be looking out for the amazing things that you're doing. And hopefully, when I'm in Canada, I'll try and pass by because now I think I have two people to see, yourself and
Absolutely.
maybe Professor Madu. But any last words for our listeners?
Yes. One last thing I will say is I think sometimes as young people, you think that you don't necessarily have something to say or something to contribute. And I'm here to tell you that in a changing world where so many institutions are being dismantled and then rebuilt, there is an enormous amount of space and necessity for young people to come out and say what they need and build and just take up space. I think a lot of the institutional memory and institutions that have existed until now are falling apart, unfortunately. And so there's a real need for creativity and entrepreneurship and for young energy to come in. So wherever you are, you have something really important to say and you have something really important to contribute to our ongoing conversations about rebuilding, whether it's global health, health security, or health in general, or the world in general. So whatever space you're in, just take up space because you belong there and we need you to, and we need your ideas, we need your creativity.
Well, thank you so much for your time. If this is the first time of listening to this podcast, this is a Global Health Uncensored podcast brought to you by Dr. Banda Khalifa. We are live on YouTube, LinkedIn. We'll also be posting this on Apple and Spotify podcasts. Until next time.